All right, everybody, welcome back to the Adventure RX podcast. I'm your host, Dr. Nick Anderson with Pinpoint Physical Therapy. Super excited today to have on Kate Shoger, one of my friends and previous colleagues. Kate is the owner of Full Bloom Physical Therapy out in the Cleveland Heights area. A McKenzie certified for orthopedics, along with being pelvic floor certified as well. A nice mishmash and blend of those two, as we were just talking before the show started. Kate, thank you so much for your time. And, the pelvic floor population, I think, is extremely underserved. And I'm really excited to have this chat today.
Thank you. I'm happy to be here. Thank you for asking me.
Yeah, of course. This whole thing got rolling. We used to work together, and that sort of, broke up. And we each started our own practice. You went more all in. I went more side hustle. And I grew mine slowly over the last few years. But you and a few others kind of pushed me into it. A little peer pressure is good. So, appreciate you guys for sure.
Yes, I certainly wouldn't have gone this direction either had I not had, former colleagues that I'd seen be successful in starting their own business. We were just talking about beforehand, zero regrets whatsoever. It's been so freeing to practice in a way that feels in total alignment with my clinical values and personal values and how work now fits better into my personal life. So yes, zero regrets. And I think that I see both traditional orthopedic cases and pelvic floor cases in a lot of back and forth between those two realms. So I feel like I'm in a fun spot right now in my career and the type of clientele that I'm seeing. So it's been awesome.
Yeah, it's been really great to see you grow Full Bloom. It's been fun, and it's given me confidence seeing you and a few other of our friends. They're out there doing it and killing it, and gives all of us confidence that, hey, we can do this private practice thing. Seeing others be successful at it. What's your mission with Full Bloom? When you started, about 3 years into it now?
Just past the 2-year mark.
Awesome.
Yep.
What's your mission?
So the kind of how I was thrust into this path was just because I was continuing to become more and more frustrated with how we're kind of forced to practice in a traditional insurance realm when it comes to physical therapy, just because of how insurance reimbursement has kind of changed over the years in a not so great way.
Yeah.
So I think my mission in starting my own business is just to provide the highest level of personalized care that I possibly can to either orthopedic or pelvic floor cases and be more involved in my community. I specifically chose to, I live in Cleveland Heights. My practice is in Cleveland Heights. So therefore I tend to treat mostly people that also live in Cleveland Heights, which is awesome. So I feel way more integrated into my own community now. So I feel really, I don't know, just the ability to bring higher level care as an option to my community has been awesome.
Yeah, for sure. I love that. I would say we're non-traditional as far as our settings, which is unfortunate because I think it should be more traditional, right? Maybe it's not, the private pay model, but if insurance ever starts paying more, we'll see. Likely not going to happen. But I would say all physical therapy offices, or if you're a patient listening, aren't created equal, and we all have our own little niches, especially in the private practice realm. And I think it's really great that there's more of us out there going off and branching out because, gosh, there's so many patients that are underserved, especially in the orthopedic realm, specifically in the pelvic floor arena. People that are listening that may not know what pelvic floor therapy is or have never heard about it, break that down for us and tell us more about what that means.
So when we say pelvic floor, we're talking about a group of muscles that sits at the bottom of our pelvis that functions to literally hold up the pelvic organs. Obviously, there's a sexual function with the pelvic floor muscles as well as a stability function. I think of the pelvic floor muscles as an integral part of the core. So that's where a lot of interplay between my orthopedic and pelvic floor practice happens because, if I'm treating someone with back pain or hip pain, especially if they've done lots of treatment for it in the past and just haven't been able to figure out what is what, why is it not improving, I find often there's a pelvic floor component going on. So if we kind of integrate pelvic floor into how we're thinking about their treatment, sometimes that's the game changer for them. So I kind of like to I think I have a little bit more of like a wide angle lens approach to pelvic floor, and that I'm not just focusing on your pelvic floor muscles, like that's a part of the picture. But when I think of pelvic health, I'm thinking of the actual bony pelvis. I'm thinking of your spine. What are your ab muscles doing? What are your back muscles doing? How is your rib cage moving and your thoracic spine moving? What does your foot look like? There's so much more outside of just the pelvis and the pelvic floor that impacts how our pelvic floor is functioning. And I feel like that's where it's been really fun to integrate both lenses, both orthopedics and pelvic floor, to help people to the best of my ability. But what I tend to see as a pelvic floor physical therapist, like if someone's coming to me specifically for pelvic floor treatment, most often I'm seeing cases involving incontinence, like urinary incontinence is probably one of the most common diagnoses that I see. Pelvic organ prolapse diagnoses, pain with intercourse is probably one of the more common ones that I see. Also, constipation, honestly, is a huge one that I treat frequently. And along with those like more like clear pelvic floor diagnoses, I'll often find these people also have back pain, hip pain.
Yeah.
Those things tend to go hand in hand. So I feel like it's fun because sometimes someone will come to see me for what they think is like a pelvic floor diagnosis and it ends up being way more of like kind of orthopedic treatment, or someone comes to see me for what they think is an orthopedic issue, and sometimes we're delving into pelvic floor stuff, which is not necessarily what they were expecting.
Right.
So sometimes we got to, take some finesse to bridge that gap
For sure.
sometimes. But I just like the fact that I can view, we can take all those things into account and I can really treat the whole person in front of me. So, I have patients that have seen me in the past for something orthopedic and now they're coming back to see me for something pelvic floor related or vice versa. So that has been fun.
Awesome. Yeah. Do you agree that I would say postpartum women are so underserved in this aspect. Like, I'm sure you
Yeah.
have some strong opinions. You have a few little ones yourself. Like, what are your thoughts on that?
For sure. I mean, in other countries, it is standard of care for women to see a pelvic floor PT postpartum, regardless of
I
how
didn't I
birth
didn't know that.
happens.
Yeah.
Yeah. So whether or not they have a C-section or a vaginal birth, it's just standard of care for them to go see pelvic floor PT. Obviously, that is not standard of care in this country. So I feel like there are a lot of people that, end up developing pelvic floor issues further down the line that probably could have been prevented with some targeted rehab immediately post birth or within like the first couple years post birth. I always tell people though, like, I see people who have issues that have literally been around since they had kids, and we can still make impacts on them years or honestly decades after.
Wow.
So it's not like you're a lost cause if you don't get rehab initially, but I do think that we do a disservice to women that have had babies by not assessing them for, what's going on in their bodies postpartum and like working on rehabbing those things in the short term just to set them up for future success down the road. I feel like a lot of things are obviously, this just as well as I do. Our body's a master compensator. So I feel like we can get away with a lot of things for long periods of time sometimes, even if, you're not firing muscles correctly or posture is not fantastic. And I think if we address some of these things in the short term, people would just be set up for success in being as active as they possibly can for as long as they possibly can. Because especially for women, like I think one of the major reasons that women become less active over time is like maybe they're leaking with exercise. So they don't want to exercise, they don't exercise as much, and then they get weaker as a result of that, and the leakage gets worse. So then there's less and less that they can do
Oh man.
without the urinary leakage. Exactly. So if we nip some of these things in the bud initially, like really we should less likely for that stuff to be impacting them later in life.
Yeah, I think it's crazy, so you get your knee replaced, right? And you follow up with your orthopedic, like after surgery, after, a couple months, you go to PT. That's standard protocol, right? With any surgery. And hopefully it gets there one day. I don't know if it's improving at all. You're in that field more than myself.
I think we're
Gosh,
working
but
on it, but
yeah.
it's a big shift to have to make, obviously. I mean, even just to thinking about C-sections, like if you have a major abdominal surgery, when you're in the hospital post-op, a PT is going to come to see you to train you how to appropriately roll in bed, how to appropriately get out of bed, stand up from a chair, like teaches you these movement strategies so that you have an easier time in the initial recovery period. That
Sure.
does not happen after a C-section.
Wow.
You just get tossed a baby after having a major surgery and told to go home and figure it
Oh,
helped.
that's great. It's like, okay, hernia surgery is one thing, but like
Yeah.
hernia surgery and then here's a little baby. And like no advice. Just
Yes.
like good
Just
luck getting out
have
of your
at
car when you get home, not
it.
knowing how to brace or anything. Ay, ay,
Yeah.
ay.
So it's very unfortunate. Hopefully, I mean, there are definitely people out there with the mission to improve, especially like the immediate postpartum
Yes.
care, like within hospital. But obviously, that's going to be a big shift to make over time.
Yeah, do you work with many active moms that want to get back into weightlifting and get back into running and activities?
Yes, I would say within like pelvic health, like there's a wide spectrum of like types of cases that you can treat. So I would say my kind of like niche within pelvic health tends to be like more active women that are feeling like they're being held back from the activities that they want to be doing because of the pelvic health symptoms that they're having. And I feel like just generally our generation of women and generations upcoming behind us are just like being active is just like has been more a part of our lifestyle than prior generations of women. So we're pushing the envelope a little bit more physically than has been done before. And then I think women are, for that reason, are butting up against pelvic health concerns that they may not have otherwise, like just going about their day to day lives. They may feel fine in their day to day life, but, they're leaking when they're, overhead pressing at the gym, or
Yes.
they're trying to run a marathon and they're leaking when they're running a marathon. Maybe they have ab separation after pregnancy and they're having a really hard time getting their abs back online for the types of physical activities that they like to do. So I would say most of the pelvic health cases that I'm treating tend to be women that are focused on, either preventing some of these issues from happening or rehabbing post birth so that they can get back to doing what they want to do without pelvic health concerns.
Love that.
Hmm.
One of the things you see in especially powerlifting in women is like you're saying that leakage, and it's almost like a weird it's like braggadocious, almost like, I deadlifted 500 pounds and like there is the effort, but even at
Yeah.
that level, right? That's not normal, correct?
No, definitely not normal. And I think in a lot of cases, sometimes like I'll have patients that like one example I see often is people that will be leaking with jump roping,
Okay.
like double unders and stuff like that. And sometimes it's amazing to me like the small tweaks that we make in like the posture that they're using that makes, I mean, literally just gets rid of the weak. Sometimes it's not a strength issue at all. Sometimes it's a form issue. Sometimes it's like how they're bracing when they're doing a max capacity lift like that. There are always things that can be tweaked so that your pelvic floor is not having to endure that degree of pressure.
What are a few cases that you've seen that, there's some overlap? Obviously, like low back pain's one. I'm sure there's a lot of overlap. Possibly some hip issues. What are some of the more common things you see if anyone's listening that maybe there's a little overlap there, overplay?
Yeah. Actually, I have one interesting like reverse case of that. I had one patient that was referred to me by I think her OBGYN. She'd had like diagnostic like she'd had every diagnostic done on the planet. She was having like severe lower abdominal pain. So she'd had a ton of imaging done to make sure that her like pelvic organs were okay. No one could figure it like GI diagnoses, like no one could figure out like what was going on, but we are assuming it was still like pelvic health related. Like maybe it was, something muscular, like nerve related going on in the pelvic health realm. She was referred to me by her OBGYN specifically for pelvic floor PT. Ended up figuring out that the pain in her abdomen was referred from her lumbar spine. It was just wrapping around to the front of her abdomen, probably like upper lumbar spine.
Yeah.
And like literally, like this woman was in severe pain, was like having to scale back on like the amount of work that she was doing, like cut back on work hours, like not able to be active at all, like couldn't go sit and watch her kids like sporting events because she could not sit. It was so painful. Literally within one session of doing lumbar spine repeated motions, did not have any pain.
That's so
Like
cool.
within session, she felt a ton better and then went home, continued to do her exercises, and she was like literally this is a miracle. I don't know like how this is even possible. I've been in so much pain for such a long period of
Wow.
time. But I feel like that stuff always sticks in the back of my brain is like we have got to we have to take a wide angle approach. Like, yes, obviously with pain in that region, we need to be concerned about like what organs potentially could be causing symptoms there, but it could be referred from the spine. So when my I feel like career motto in PT is when in doubt, like screen the spine fully. The number of symptoms and pain that I've seen referred from the spine out of the spine is wild.
Yeah, I think that's something I've picked up too from one of the McKenzie courses, but also working with you and Jessica and Jessica over at our previous employment. Um, Again, it's not chasing location, right? And from the few years I've been on my by myself now, I think a lot of pain is referred.
Oh yeah.
A lot of it, or
Yes.
a majority is
Yeah.
nervous
Or at
system
least like
related
a component of someone's pain
or a
is referred.
component.
Yes.
Yep, yep, exactly. It's more than you would expect, and I'm sure you've seen patients that have gone through whatever kind of care and know, I'm like, oh, did they look at your back? Oh no. Oh, did they look at your neck? Well, no. And then, like you're saying, repeated motion or some manual therapy, and then voila, it's 50% difference. It's fun. It's fun to catch those cases for
It
sure.
is fun. I know. And the opposite side of like the relationship or kind of like overlap between pelvic health. I had a patient recently who came to see me so this is someone who came to see me for orthopedic treatment. Her back was really hurting. She happened to be a mom in like, I think she was 8 months postpartum. So she liked the fact that I also did pelvic health, but she specifically came to see me for low back pain. Ended up figuring out that like, her back mechanically like looked pretty good, like movement was okay, like maybe a little bit of muscle tension, but nothing that I would be expecting to like create the degree of pain that she was having. Ended up figuring out that she, had some other like lingering pelvic symptoms going on, so that prompted me to look into like perform a pelvic floor assessment and treatment. So with treating her in particular, ended up treating her pelvic floor tension specifically and adductor tension, inner thigh tension, like totally got rid of her low back pain.
Yeah. No,
Like
it's
really didn't even have to do anything for the low back itself. Maybe some like deep core strengthening. We implemented into her care, but what actually got rid of the pain was getting rid of tension in her pelvic floor and her adductors.
gotcha. Yeah, people are interesting, man. It's fun.
This
Is
is
it?
this is the most
Yeah.
fun part of my job is that it's constant problem solving and everyone is different.
Yep.
So
No
someone,
one's tech. No one.
four different people with back pain can walk into your office and you're sending them home with like four different, totally different things to be working
Different
on.
plans. Exactly. Give me a few myths, maybe they're pelvic floor related. I know we went through the lifting with leaking, a few things that you want to squash. This is one of my favorite questions because I never know what I'm going to get, whether it's PT or fitness or mom related or whatever. We'll do like one or two myths that really bug you that you want to
Yes.
put to bed with quality research backed information.
Sounds good. Well, I
Yeah.
think that probably the biggest thing that comes to mind in the pelvic health realm is that everyone assumes that when they're leaking, their pelvic floor is weak, so they need to be doing Kegels.
Okay.
And I honestly like the frequency with which I prescribe like isolated pelvic floor muscle contractions or what most of us know as Kegels is like I honestly can't remember the last time I prescribed Kegels.
Wait, okay.
So I find that when people are coming to see me for leakage, if it is truly a weakness problem, we get much more bang for our buck by actually strengthening the hip musculature and the ab musculature. And we actually know from research that you get a stronger contraction of the pelvic floor muscles when you're doing something like a bridge or a squat or a lunge than you do if you're just sitting there trying to like do a squeeze of your pelvic floor muscles. So, like, why sit there and do a squeeze of your pelvic floor muscles? Let's actually strengthen the muscles functionally with the other muscles that fire along with them by strengthening your glutes, your adductors, your lower abs. That's a huge one that I think people come in to see me, and a lot of them still think I'm going to give them Kegels as an exercise, and I almost never do.
Yeah.
Also, a lot of people that come to see me don't need strength is not an issue at all. A lot of time tension is the issue, and they
Okay.
actually need to work on releasing tension in those muscles so that they can actually contract effectively. And that's like any muscle in our body, like, a quad muscle that's like super tight and has a ton of trigger points, is that going to contract as effectively as it should? No. So if we can get the muscles to relax a little bit and, strengthen through full range of motion instead of just strengthening through this teeny tiny little like tight range of motion is always going to be helpful. So that's probably one of the biggest misconceptions that I feel like I come into contact with in like the pelvic health realm.
Yeah, I think that blends perfectly what you said earlier with orthopedics taking a bigger view, right? Like squats are
Hmm.
foundational movement. Like everyone should be
Hmm.
able to squat. 99% of people should probably be squatting. Um,
And hinging.
and
My God.
it makes a lot of sense, with
Yes.
let's full body compound movements are very, very good for most people.
Yes, they
And
are.
we can regress and progress them.
Yes.
I said with Ricky the other day, I'm like, dude, let's get rid of the yellow TheraBand for a runner with knee pain. Like we looked it up. You land with 2 to 3 times your body weight on a single leg. Like
Hmm.
we got to be
It's not
better
going to
as a
cut it.
profession. We got to be better.
Yes. It's not going to cut it. And I think that where, pelvic floor, doing some of these more like what we'd consider orthopedic exercises with a pelvic floor focus, a lot of times for me really comes down to breathing and pressure management. So, maybe someone can do a squat, but they're holding their breath the whole time. And like that's not ideal for how your abs and your pelvic floor are going to be functioning. Maybe, you know, I'm trying to think of an example of how. Okay, I had a patient recently who actually was leaking with like a heavier loaded squat, and she was doing a Valsalva like brace while she was squatting, which it's not inherently bad. But what we had her do was instead of inhaling and then holding her Valsalva at the top of an inhale, I actually had her slightly exhale and then hold Valsalva. And that was enough to reduce the leakage. So just like slightly reducing
Yeah.
the amount of pressure that you're holding in your core canister was enough that her pelvic floor could then like meet the demands that she was asking it to meet during a squat. So sometimes it's just like little tiny little tweaks like that to give our pelvic floor some help.
Yeah. Do you ever look at running technique at all with runners
Hmm.
in that
Yes.
realm? I know a lot of the low-hanging fruit can be simply increasing cadence and reducing stride
Hmm.
length to lower
Yeah.
impact per lower impact step. So those ground reaction forces.
Yeah. So obviously that makes sense from a pelvic floor perspective too. Like if we're dealing with a pressure management issue, running is obviously asking it's a lot of impact, asking your core to manage a lot of pressure. Cadence increase is definitely something I'll work on with people if they are overstriding. Also, I've had some tweaking of like the upper body posture that can be very impactful in some of my patients that are leaking with running. Like I have one person that comes to mind who, when we watched a video breakdown of her running gait, she was like on every single impact, she was like kind of like crunching through her thoracic spine. So
Right.
basically like pressure down, pressure down, pressure
Yeah.
down, pressure down. Instead of kind of keeping the rib cage like upright and stacked over the pelvis, she was just crunching every single time she was landing. And so literally just by having her focus on, not doing that crunching pattern on every foot land, she did not leak anymore.
Oh, that's so cool. Yeah, just
Yes.
small tweaks.
Hmm. So yeah, like if we were operating under the assumption that everyone that's leaking with running just needs to be doing a million kegels, we'd be doing a major disservice to people when all we need to do is like slightly tweak their form or the pressure that's coming from above down onto the pelvic floor.
Yeah, yeah. Just like runners with knee pain don't need to be doing clamshells with a yellow TheraBand.
Yes.
We can be better, people. We can be better.
Mhm. Yes, we can.
Do you think in PT in general, do you think patients are underloaded or overloaded?
That's not a question. They're underloaded.
Underloaded, yeah.
Yes. One thing I find super, I don't know if you're also experiencing this, but one thing I find very encouraging of late is it feels like I have a lot more patients that are like interested in and wanting to get into strength training and they like just don't really know how to do it. So I feel like I have a lot of people that are like, can you help me like bridge the gap from like, this injury that we're rehabbing into like general wellness of like lifting weights because I like want to do that on a regular
Right.
basis. I want to do it safely. I want to make sure my form is good. So I honestly work on that with like a lot of people, which I think is awesome that people for whatever reason are becoming more interested in it because honestly, I think all of us should be strength training.
Yes.
in
Yep, that
some
should be
way
like a
on a
weekly
regular
vitamin,
basis.
weekly vitamin. You should be strength training. I would say that some of my patients do want to get into fitness, like bridging that gap. And where I'm
Mm-hmm.
at, I have some of the in the gym, the coaches and personal trainers can help bridge that gap. I work closely with them, developing plans of care. They might be other gyms as well, you know, already training, or maybe they want to be a new member in a gym and get into the swing of things
Definitely.
along with, you know, current weightlifters that want to improve their efficiency or just get
Hmm.
little tune-up sessions. I have a few competitors that are going to states and some national meets, and they're just crazy strong women and very impressive. And you know, touch base with them here and there. But even someone that's that strong, right? Like, there's always small tweaks and some deficits here. Maybe it's mobility, maybe it's stability here and there
Hmm.
that we can touch on in the gym or heavy-handed manual therapy or
Hmm.
mobilization, you know, whatever may be. So no, it's fun. I think there's a huge component in healthcare. I'm doing the workout this Friday that there's some coaches and personal trainers and physical therapists and orthopedics and massage therapists that are coming and chiropractors. I think there's like we should all be blending and meshing together.
Hmm.
I don't view it as competition because we can all help these patients, and
100%.
you know, everyone has their own niche and you know their own feel for what they do. And yeah, I think we're missing that. I think it's getting better though, like you're saying, going from. I think it's tough to go from like a rehab into working out. Like it's
Yeah.
such a gray, and it's so cool. It's such a gray blended area.
Hmm.
I with my patients, I generally use the RPE scale,
Yeah.
0 to 10 effort. As they're rehabbing, we're keeping that RPE sort of in that mid range and
Hmm.
keeping pain in the low range, like
Yeah.
symptomatic in the low range.
Yes.
Especially if we're talking nervous system injury, the next day, how are you feeling? If it's fine, then okay, like, continue to progress it.
Hmm.
But I think out of school, I don't think we get a very good feel in school for really the fitness side of physical therapy. And we come out saying we're the movement experts, right? But what to what extent, right? Because I know some really good trainers and really good coaches and strength and
Yeah.
conditioning specialists that, you know, would blow any therapist I know out of the water.
Totally. And I do think like, there's some patients that like I'm not the right person for them to
Right.
be to get them to where they need to be in that regard. So
Hmm.
that's why it's important to have colleagues that you can refer people to if that's not like your
Yeah.
little
Yep.
uh
Yep.
absolutely. And I find I feel like one of the most fun parts of our job in terms of like the problem solving is like, you know, a lot of my patients do a lot of different types of physical activity. So figuring out like for them specifically, like, maybe they're not going to go to a gym and do strength training. So like what equipment do you have at home available to you that we can make work in a way that is actually still going to strengthen you in the way that we need you to be strengthened. So sometimes, like you said, using RPE is a great thing to use when it comes to that because it's like, okay, regardless of what types of weights you have at home, let's try and stay in this rate of perceived exertion when you're exercising. Or I like to think about reps in reserve often. So, like, okay, you know, whatever weight you're using to do an overhead press, like, let's try and get to the point where you've got like maybe 1 or 2 reps in reserve, and that's where you end your set in order to achieve the goals that we want to achieve. So, that's, I think, fun is working with, I don't ever want to poo poo really any type of exercise that people like to do because at the end of the day, if you're moving, that is good.
Yes. Yes.
I like to help people do the types of exercises that they like to do. Ultimately, I think strength training is fantastic. So if we can get people on board with that in some capacity, that's great. On top of the things that they like to do otherwise.
Yes.
But it's fun, very fun, like problem solving that and figuring out ways that people can make that work for them.
Yeah, I think you hit the nail on the head with choosing a mode that they like to do. Not
Mm-hmm.
everyone's going to, and I don't want to go to Planet Fitness 3 to 4 times a week, right?
Yes.
And you know,
I
it's
certainly don't want to.
not for everybody, right?
I'm
Maybe it's,
lifting Craigslist weights in the basement.
finding a mode of movement that if someone's not very active, you know, they have to like it or they're not going to stick with it, right? It's like
Yes,
90%
absolutely.
of New Year's resolutions fail because people choose things they don't actually want or like to do.
Hmm.
It's like if you haven't been going to the gym for a decade and you start going 6 days a week, it's not sustainable. It's not a sustainable goal or habit, at least in the long term for most people. For 90% will fall off. But yeah, like, choose a mode that you like. Whether that it could
Mhm.
be as simple as walking a little extra around the block each day. It doesn't have to be anything crazy.
And I find when if you do start that way, like with a form of exercise that people like to do, or that's like low barrier to entry, like something like just walking, I feel like once they, feel like they're in a groove with that and they actually start to enjoy it, like it's consistently a part of their habits at this point. They like doing it, they feel good as a result of doing it. I feel like it's easier then to like layer on some additional, potential types of exercise.
Sure. Yeah, just habit stacking. Habit stacking, absolutely. What is next for Full Bloom PT? What do you have going on?
Man. I'm kind of in a mode right now where I'm just like keeping it consistent.
Your
So
steady
I have
state. That's good.
Yeah, so I have a 2 and a 4 year old, so I'm busy on the home front of things. So I'm just kind of happy with where I'm at right now. Like seeing the size of the caseload that I'm seeing on a weekly basis, the types of patients that I'm seeing. At this point, most of the clients that I'm seeing are coming to me either from word of mouth or, finding my website on Google because I'm near to where they live and liking what they have to see on my website. So they decide to come see me for that reason. Pretty much all of the patients that come to see me are for those 2 reasons.
Nice.
So I am just kind of letting my people find me and kind of coasting at this point in time. As far as like things, growth in some way, have considered currently rent space inside of a yoga studio, have considered maybe having my own space at some point. So that would be my potential next move, I would say. Just because right now I do have to get fairly creative in terms of I don't have like a ton of space dedicated for exercise. I have a very nice like treatment space. So where we do our manual therapy, dry needling, all that good stuff, which I like to view as like opening the window so that we can move better. But I also think that exercise is obviously extremely important. So we're doing some exercise here, but I think if I had more space, I would be able to have more equipment, be able to more consistently implement exercise like in clinic more than I am now. So I think that if as far as where I'm going next, probably my own space at some point.
That's exciting. Very exciting.
Yeah.
I think that's the goal too. I would love a space ideally where there's a gym setting. We have a, maybe a couple PTs, would have maybe a very good strength and conditioning specialist, maybe a massage therapist on staff, like just a very encompassing
Yeah.
space would be so cool. I
Yeah.
don't know if there's anywhere like that right now that I can
No.
think of in the Cleveland area.
No.
I don't think there is, but just like a good spot, you know, have a coffee bar in there too, just
Form
very.
some community that way.
I can see it, like it's gonna happen one day. Like I can see it. I'm
It
envisioning
absolutely
it.
will happen.
It's gonna happen one day. But Kate, you
Yes.
sound very happy. Thank you so much for the time today.
Thank
I wish
you.
I wish you all the best. We have to catch up in person soon. It's been too long.
I'll
All right.
escape my kids at some point.
Yes, you are very busy. You are busier than me right now with the little ones. Again, this is
That's good.
Kate Shoger out in Cleveland Heights area with Full Bloom PT. Thank you, Kate.
Thanks, Nick. Bye bye.
And we're good.